What does a chest X-ray reveal about CF lungs? When we talk about what a chest X-ray reveals about cystic fibrosis lungs, we are looking at a tool that helps monitor lung health. This imaging method is quick and commonly used, often performed once a year for people with cystic fibrosis. While it does not show how well the lungs are functioning, it provides important insights into structural changes that occur due to the disease. One of the key findings on a chest X-ray for cystic fibrosis is bronchiectasis. This condition is characterized by the thickening and dilation of the bronchial walls. On an X-ray, bronchiectasis can be seen as ring-like shadows and tram-track patterns, indicating that the airways are dilated and thickened. Another common observation is hyperinflation. This happens when air gets trapped in the lungs, leading to increased lung volume. On the X-ray, this appears as flattened diaphragms and an overall increase in lung size. You might also notice parabronchial cuffing and bronchial thickening. These signs indicate inflammation and mucus buildup around the airways, which show up as thickened walls on the X-ray. Mucus plugging, or mucoid impaction, can also be visible, appearing as areas of increased opacity or dark spots on the image. Additionally, increased interstitial markings and scattered nodular densities can be seen, reflecting chronic inflammation and scarring in the lung tissue. Sometimes, chest X-rays can also detect complications like atelectasis, which is lung collapse, or pleural effusion, which is fluid buildup in the pleural space. However, it is important to note the limitations of chest X-rays. They may not capture subtle or early changes in the lungs due to their low spatial resolution. They also do not provide detailed functional information, such as how well air is moving in and out of the lungs. For more sensitive imaging, high-resolution computed tomography scans are often used, but they involve higher radiation exposure. Despite these limitations, chest X-rays are valuable for routine monitoring because they are accessible, cost-effective, and expose patients to less radiation compared to CT scans. They play a crucial role in tracking disease progression and detecting complications in cystic fibrosis lungs. However, they are usually used alongside other imaging techniques and pulmonary function tests for a complete assessment of lung health. In summary, a chest X-ray reveals structural changes in cystic fibrosis lungs, including bronchiectasis, airway thickening, hyperinflation, and mucus plugging. It provides essential information about lung health, helping healthcare providers monitor the condition effectively. Always consult with a healthcare professional for personalized medical advice regarding cystic fibrosis and lung health.